Well, let's go ahead and call the meeting to order. I don't have the agenda in front of me. My email is to get reset. Okay, so we'll go ahead and call the meeting to order and let's have the pledge of allegiance. You two stand. Jeff, get out of your car. Stand up. I pledge allegiance to the flag
of the United States of
the
America
United States
and
of
to the
America,
republic
and to the republic for which it stands,
under
one
God,
one nation.
God,
liberty, and
indivisible,
justice for all.
liberty and justice for all.
Next time we mute them,
Yes.
throwing us off. All right. So, any guests? No, I don't see any. Let's go ahead and review and approve the minutes. Everybody had a chance to review
I'll make a
those?
motion to approve the minutes. I had a chance to read it, so I make a motion to approve the minutes.
There's a motion. Is there a second?
A second.
There's a second. All right. Any further discussion? Hearing none, we'll move on. We'll do a roll call vote. Jeff,
Yes.
Susan,
Yes.
Zach,
Yes.
what's your name?
Kim, yes.
Michael, yes. All right. That's all. I thought you'd throw something at me. All right. No old business to go over. Hearing none, we'll go ahead and go to subcommittee and reports. Director.
Go ahead and scroll down. Last meeting, we had a really kind of long meeting with a lot of different things that we approved. Some of the things are in my report. There's a couple of pictures, as you noticed when you probably walked in, for those who are here. And Susan and Dr. Kingsley actually have both been here since the last meeting. So I know they have seen it too, but the parking lot has been crack filled and seal coated and restriped since the last time you were all here. They did get that done on Halloween Day, actually. So, and one of the nice things about, they've also done the fire hydrant. And so we had told the plumber who did the fire hydrant that they would be doing the parking lot. And so they said, I thought it was nice when Cindy had talked to that contractor, they said, well, we'll have some heavy equipment. We'd like to really get that done before they do the parking lot, just in case we would scratch anything up. So we're not going to be marring up your brand new surface. So we thought that was pretty considerate. So they actually did that right before they did the seal coating and stuff. So both of those jobs have been completed. They tested the new fire hydrant and it passed, right?
They haven't sent me the report.
But it
He was
passed.
gonna tell me if it failed, so it should have passed.
And if not, it will get taken care of. But we don't have the official report in hand. You can go ahead and scroll down. But there's the old fire hydrant and there's the new fire hydrant in progress. We continue to work on with the contractor on the HVAC stuff. We are getting closer and closer, but still dealing with some of the stuff from basically install. You know, the latest thing, I think, what, 2 days ago, over our clinic desk, from pretty much the day we moved in, we have had just one of the units has been really noisy, kind of a thumping sound. We've been complaining. We have told them about this forever. Well, it was a piece of rubber gasket material that was about this long that was on the curb, which is what the RTU sits on, that was just hanging down. So it was kind of just an oversight when they were installing it, and it was banging whenever the fan came on against the side of the ductwork. They trimmed it. It's been fixed. The clerks are like, it is so quiet over here. Yeah, 2.5 years later.
Jeez.
We are getting close. I mean, It's frustrating. It's great that it's being taken care of. It's just kind of frustrating that some of the stuff, it has taken kind of the full court press of Taylor, Frank and I since July of us having to be so involved with this these past 5 or 6 months to get it done. But we are getting it done and we will finish off and then I am going to retire from the HVAC business. So
Leaves, if I may, it leaves a good taste in your mouth about retention. They won't dance without the money. If you've got a problem and you don't owe them money, they will do nothing except send you a bid. And I think this is really good. And I know it's been a headache for you. But the bottom line is, unfortunately, a lot of these vendors do the work. And if you don't hold the money back and confirm the job's been done right, you're gonna lose money. So I think it's a lesson learned for us all to make sure we always have retention on any project. We have bid, at least 6 months of retention, which is essentially their profit, which is reasonable and it's standard in the industry. So unfortunately, you've gotten a crash course in it.
but we are getting close and things are working the best they have. Knock on here, Dustin. But they are working and people have said, they've even commented on how well things are working. Not to jinx it, but things are looking up, but we are ready to be done. So you can go ahead.
Do you have an endpoint?
On our list, we have probably about,
15 things on the list.
well, how many things do we have outstanding? There's 10 minor things. I
Well, the
mean,
rattle, they fixed the rattle, so I think they did 2 things since I wrote the report, so I think 7.
but they're
almost
pretty
half.
minor. I mean, we're getting close.
That's good.
I mean, they're not as major as some of the Taylor's like, I just want to be done too, so.
Don't let that, I'm sorry, it's not a trustee's position.
We're not letting them get away with anything.
No, but I think what you guys are learning is that there is this, in this kind of an industry, there's fatigue. And companies do count on fatigue occurring. But if you have a legitimate issue to hold back their profit, that's the industry.
Yeah.
They know it. And unfortunately, a lot of payers don't know. So
We have a significant amount of their money.
yes, it is. And that's why they're taking care of things.
And they know for a fact, I will not give them their check until everything on that list is done.
Bless
And
you.
I've told them.
Bless you, Obi-Wan.
I mean, they know I'm not negotiating on it.
Nope.
So it is what it is.
All right.
Revenue, at the end of October, we were at 83.3% of the year. We had brought in 88.7% of our revenue, or $3,491,213. Our expenditures were at $3,420,018, or 81.2% of our expenditures. You can go ahead and scroll down. Our money market, we were at $1,065,390. We were about $179,293 less than we were at this point last year. And then, which was just a little bit over where we were 2 years ago. And then our lease purchase, we were about $200,000, basically what we paid off in the past year. And that's my report.
All right. Any questions?
Oh, actually, that's not my report. This
Okay,
is Dr. Kingsley's favorite part,
okay.
because he continues wondering why we pay customers to tell us all these good things about us. We had,
It's totally Rick, you can tell.
so I think last month I had told you that we had 17 people take our survey. This month
24.
we have 24, and I'm just amazed by our team, because I think I said during staff, well, it must have been Taylor, because I don't think I was at staff meeting. So she must have said, don't forget to tell people to take the survey. We got 20, or they must just listen to her better. But 24 people took the survey, and you can kind of see those answers, but go ahead and scroll down to the ratings. So we had, how would you rate our service? One person rated us 4 stars, 23 rated us 5 stars. There was a little bit of an anomaly here. How easy was it to use our services? One person rated us 2, 2 people rated us 4, and then 5 people rated us, or 21 people rated us 5. When you look at, now I can see all the whole submission. Can you go back up? So that person who rated us 2 stars, they rated us 4 and 5 on the other categories. So I'm not sure what happened, and their comments were all positive. So who knows? I don't know. There was no reason that I could tell why they rated us a 2 there. Just an anomaly. But how friendly and helpful was the staff? 1 and 23. Again, just wonderful ratings. The comments are always fun to look at. What did you like about your visit? The receptionist is always so sweet. Front desk is always so excellent and personable. I love her so much. It was easy and fast. Lady was helpful, super helpful, very chill. She helped me feel calm and relaxed. Helpful resource, the service. Go ahead and scroll. Staff, friendly. Receptionist was kind. They care. What can we do to improve? Kind of just more of the same. Nothing. Good job. Keep it up. I mean, I think all of you have seen customer service surveys. Typically, they're not this glowing. I mean, a lot of times you see good stuff, but pretty incredible. So,
It's validating.
yeah. I did write this, so I couldn't write this any better than what I did. No, I'm joking. But very proud of the team every time I read these.
I'm
Great.
what does it mean? Let us trade out uncapped happy bottoms when they outgrow the size. I'm confused.
So Happy Bottoms is the diapers. So basically what they want to do is when they get some of the diapers, they want to be able to bring back the unused ones and trade them out. And we can't do that. That's not our policy. That's a Happy Bottoms.
That's what Facebook Marketplace is for. Just kidding.
And that's why you don't get a 5. No, I'm joking.
I'm imperfect.
But that's not what we can do.
Understood. But I was curious.
Yeah, no, but that's what they're.
You put
talking-
it up, I'm gonna ask.
No, that's what they're talking about is they want to be able to just trade them out. But a lot of times what we would tell them is, do you know anybody you could trade them out with or something?
They can take them to the hospital.
Right.
All
Is
right,
it time to move on to the deputy director report?
It is.
yeah, I'll try not to take away all the accreditation stuff from Rebecca, but I will just mention that of the plans, we've completed almost all of them now, so I think this month we just completed the workforce development plan. And that one was a big one too, so a lot of that was like focused on like future trainings and looking at like core competencies. So that is completed. The only one that we have left is the emergency operations plan, which we now have a new emergency response planner, so he's jumping right in and trying to work on that and get that ready for accreditation. We've been doing a lot of work on policies and procedures. We've had several meetings on that. So we're just working to update those. And then Andrew pretty much mentioned all of the maintenance stuff, the HVAC. I guess there was a kitchen hood inspection, fire hydrant. So I think, yeah, I mean, we've been spending a lot of time on the HVAC, so that's been not the best, but we're getting there. Progress. Every week is a little bit of progress. Right now for environmental, it's renewal season, so they're out doing lots of inspections and things. Health Ed has gone to lots of fun events this month. There was the Platte County Senior Fair, which they worked, then the Missouri Substance Abuse Prevention Conference that a couple of the health educators attended. And then a couple other some trunk or treats, and then we've been doing lots of daycare audits as well.
Right.
Pretty much.
Any questions for the deputy director report?
Nope.
Hey, none, we can move to the clinic manager.
So continuing on with all the students, they all love coming here. I know a lot of staff have been visiting with them and enjoying a lot of that. We actually have a Missouri Western student here right now who's like really, she has like one clinic day left. It's like very sad that it's ending. I think we really sparked her interest in public health and like having that as a future career for her. So it's really fun seeing how much all these students are enjoying it and then just hearing everyone else's stories with them. So lots of great feedback with that. So we're looking forward to continuing that program. We did some of our offsite flu clinics. We went to a couple businesses, some nursing homes, and then we went did our drive-through flu clinics here. The one with Harvesters was a really good success. A lot of people who weren't typically customers or come here for the Harvesters portion of it. They were really excited to hear about that program and started sharing it with some of the people that they know. So helping get more word of mouth out about that. Then you have we worked on a measles tabletop exercise with environmental health and epidemiology. So kind of planning for if like a measles outbreak were to occur, what everyone's job duties are, what we do, and XYZ happens, and trying to hope for the best, planning for the worst. And then, as Taylor said, lots of daycare audits, working on a lot of those. We should be finished with that by the first week of December. We're getting ready to change over to a new system. It's going to be browser based, so that way they'll have a lot less disruptions and like access with some of their software programs, and it should make things a lot smoother for how they input a lot of their data. And then one of the cooler highlights is a SWO. We now have like 1 full year of data's worth to kind of look and see like what they're seeing patient wise. So as you saw a year ago, they started out having 55 clients when they started. Now this past month they did 104. So pretty big increase compared to the year prior. So it's going to be interesting to see each month how that compares to where they were a year ago. So that's my report. If there's any questions.
Do you have any data on the amount of uninsured people they're seeing from Black County?
I don't, but I can reach out to them and see if I can get that.
It's really just a curious question because we have one of the most insured percentages in the state. We are really we're prioritizing, making sure nobody falls through the crack or a donut hole or anything like that. So I think for me, I can't speak for the board. I would be curious as to how well we're doing for those who would otherwise in any other county go unserved. That would be an interesting data point, I think, to archive and put into the minutes. Because I think if we're trying to hold ourselves out as the best health department in the state, that the best health department in the state would have the best numbers for providing services to the underserved who cannot get them anywhere else. Just a curious data point, not a bone of contention, but if you think about it down the road, I'm not requesting it. But if you think about it, it might be something interesting for us all to understand, because I think that may be the best barometer of how we're doing. It's taking care of the frail, the weak, the vulnerable, and those who don't have access. Just one man's thoughts.
I can reach out to them. We do monthly updates to kind of talk about stuff like that. So, so I know they also have, the Riverside Clinic. So I think the ones that are in Platte County might be able to get.
And the last question I would have on this matter that may take another month or two to sort out is, I'd like to be able to have a sense of the data to determine if it is financially feasible for them to continue services, because if we get a sense that it's not fiscally viable for them to continue, we need to know that before or at the same time they do, because that could adversely impact the services delivered to the weak and frail and those who are underserved. We need to make, I would look at making sure that our vendor who is leasing space is able to continue to do that. And that's just a curious question. I want to make sure we're watching with this data. Are we still charging them rent?
Yes. And we're meeting with them monthly to keep a pulse on that question.
Great.
So that
So-
question, tell you.
So Mike, I was wondering, do you want them to come to one of our meetings anytime soon and just kind of talk to us personally?
That would be good.
It's up to the rest of the board. If our staff is able to provide us data that this is a fiscally viable relationship, I'm fine with it.
They're not expressing any concerns with that at the moment. And we're meeting them monthly to see what they need.
That's the
and
best we can do.
We're trying to make sure.
Go ahead, Susan.
I was just gonna say that maybe it would be good if they, at least, I don't know, maybe not every month, but maybe twice a year, kind of came and talked to the board about where they're at.
I agree. I think that's a good idea.
And then that's a good communication between both arenas.
What do you think, Cam? You agree?
Yeah, or I think as long as we have information, I mean, I'm fine with, if once a year is fine with me. I don't think
Once a
that,
year?
yeah.
Okay.
As long as we get frequent information and know that, like Dr. Shefe said, that the relationship that is good and financially good situation for them to still be here.
If
Yeah,
they're,
I just
if
like
they're
to
one of
see
our
the face to
vendors,
face.
Yeah.
if they're one of our vendors and they represent essentially us to the public, we should meet with them at least once a year, if not twice a year. So whichever one you want to do, you have my support.
Yeah, I'd be interested in like biannually meeting with them just to get updates on how things are going, if there's things that, we need to consider, or if they have concerns, we'd like to know them early. And, a lot can happen in 12 months that, I wouldn't want to be caught with our pants down either.
I don't think either way is wrong, biannually or annually, but having them meet with us on the record, that's great. I think that needs to happen. However, it sounds like the staff is meeting with them monthly, and we will get telegraphed to us through the staff, hopefully, and I'm confident we would. If we are going to be in a situation where their services may no longer be available, which I think all of the board members realize that's a big deal.
Yeah.
Because it's a safety net somewhat. They are best equipped to get reimbursement, to do sliding scale, as a federally qualified health entity. So that was the main thing is I'm looking forward to try and make sure, are we gonna have enough information in advance that we might have to take actions to meet the needs of our clients and the citizens of Black County.
So what I would suggest is we will meet with them. We met with them last week, so we will meet with them in December. Dustin put that on our agenda, and we will just ask them what frequency they prefer.
That's great.
And that way they can kind of have some input. I know it's already been like probably almost 6 months since they've come, so it'll probably sooner than later anyway.
If I could speak for the board temporarily, correct me if I'm wrong. I think the board is interested in hearing a on the record update of how well this relationship is working for all parties. Just a formalized 2-minute, things are great, we're holding our own, we're looking, and just.
And do you care if it's virtual or?
No, no.
Be fine with virtual.
Just on the record that we are doing our job as trustees, confirming this is gonna continue to be viable. That if it appears to ever be questionable, we would like to know as soon as possible and or to work with them to make sure they're successful financially to a degree that they can continue to offer services. Not worried about them profiting, or I just want to make sure that we are looking after the interests of those they are serving, so that if the potential to ever change occurs, we have plenty of time to know.
And
And
I
maybe
appreciate all
Or
the
if they have any
staff.
requests.
Go
Go
ahead.
ahead. No, you go ahead.
Okay. I appreciate all the staff and what they're doing on a monthly basis. That's great. It's just that I think I would like for them to see our face as well. And it can be virtual. It doesn't necessarily have to be in person, but just so that they know the board is supportive of them as well. And we're wanting to know issues as well too, even though we're getting reports from the staff.
I agree. I want to have something formal documented for
Yes.
me as trustee, that I heard it directly and made sure that they know that we back up our staff, we support our staff, and that God forbid they ever believe that their communications with our staff are not being transmitted on to us, that there's a direct line. It's a scenario that I know won't happen, but I would feel better if we had at least a virtual chat of things are good, anything we can do to help you. Great, let us know if there's some hiccups.
And it's documented.
Yes, I like that in our minutes, showing we are, if you guys don't mind, that we are doing our due diligence to look out for the citizens of Black County.
That we didn't just hand this over and said, okay, we're done with it.
So let us talk with them and we'll get back with you next month. And I think if it is just a check-in virtual, we can probably do it every 6 months. I think if they were coming here and it was going to be some kind of presentation, they may want to do it every year, but if it's a kind of check-in kind of thing, 6 months, they will have no issue with it. But if you're wanting like more of a formal presentation, they may want less frequent. But if it's more of a pop-in, everything's going well, kind of just check in, I think they'd be open to more frequent. But let us talk to them and we will get back with you next month. Make sure.
I
that's
would
all
want,
right.
and again, I don't speak for the board, but I would want to know at 6-month intervals if things are going well and we can anticipate no hiccups for the next 6 months. Simple as that. We don't need data, we don't need slides, just want to be able to interact with them. And also provide them an opportunity to, it's not to come directly to us. Not that anything they share with you guys won't get communicated, but I think our role is to make sure these services are continue on. And if things are getting a little questionable, 6 months is adequate for us to try to scramble and figure out how we can continue these services to the frail and underserved. All right.
I mean, I think
Hey,
it
Mike.
might,
Yeah.
I gotta leave in like 5 minutes. Is there anything on the agenda that needs me to stick around to vote on or hear about or anything?
Well, that would require me to have been able to read it, but my email stuff got messed up and I couldn't get Microsoft Authenticator set up to actually access it. So no, I don't know.
How
Yes.
about you, Andrew? Anything you need me for?
Try the budget.
so the budget doesn't require any action tonight.
Okay.
That's
So-
true. We're just looking at it.
Necessarily need anything, but there is one thing that I was going to ask to add to new business. That might require Dr. Kingsley. So, I emailed it, but in there's something, hopefully you, Dr. Kingsley and Susan can see it.
Yes.
And it's on the screen, but 2025 Governmental Public Health Summit. I got a call this morning from Larry Jones with the Missouri Center for Public Health Excellence. And at the beginning of December, so in a couple weeks, they are having a governmental public health summit. Taylor and I are actually going because there's some incentive funding for a workshop that is on the pre-conference day, and we get money for going. So for some grant management training. But on the second day, on December 10th, there's a panel discussion from 11:15 to 12:15. And they would like a board member and a health administrator or director from the Platte County Health Department to be on a panel to discuss the dynamics of how a director and a board member has worked on a policy issue. So what they had suggested was how, like, we have worked on some type of policy issue, maybe like Kava and Cradle. Because they all is a good example.
It just so happens I'm available if you can't find anybody else to go.
So they
May not
asked if
want
we had any policy issues. But one of the things they really were interested in was just how our board and the staff really follow kind of the model of the board really drives the fiscal responsibility and the policy making decision, and the staff drive the everyday driving of the business and taking care of the everyday decisions.
We provide the guidance, you execute.
Right, because not everybody across the state has that model.
This is because they don't have an Andrew.
Well, and because a lot of places they don't split those decisions up or split those duties up well, and it becomes a mess is what it becomes, because people can't stay in their lane, and all of a sudden you have board members trying to discipline employees, and it
And this is
really
in
does
Cancun,
become a
right?
problem. Huh?
This is in Cancun, right?
Oh, absolutely. Yeah.
We'll all be there. Cancun, Missouri, here we come.
But this is at Old Kinderhook in Camdenton. So I didn't know who all may want to go. So Dr. Chape,
I'll commit to it,
What-
but I think
What
this
day did
is
you say it was?
December 10th.
Yeah,
How
I
about
won't be
you
able to make it. So
you send out information? I think all the board members should.
it's in your email.
I can't access it. I texted you about that.
I know, but you need to call me and I will help you.
Okay. Well, I think the more board members we have available to be there, the better.
Only one person gets to be on the panel. Now,
And-
everyone, can-
But I
I'm
just get
still
the
in
text
Arizona,
2 or 3.
so I could not be there.
Okay.
Yeah.
Does anybody else have an issue if I go?
No,
Does anybody
No.
else want to go instead of me?
I won't be able to.
I won't be able
So,
to.
How much do I get paid for? I'm kidding, I'm kidding.
I will not be
You guys
available.
know me well enough, this is yours. All right. I'll get permission
So
from the
Andrew,
wife.
so
I'll not be worried.
what other health boards are going to be there? Health department boards and such.
I think Scott Allen, might be there, but I'm not sure who else is going to be on the panel.
All right, well, that'd be good for Mike to network with other counties and do our thing for the state.
So if you want to get with me, call me and I will fix your email.
I'll come
And-
up.
Yeah.
We'll figure it
All right, is
out.
there
But-
anything else you guys need me for? Can I bail?
No, bye, Jeff. Go.
See you
Tell your
guys.
girlfriend
Bye,
hello.
Jeff.
Have a good Thanksgiving, everybody.
Happy Thanksgiving.
Bye.
Happy Thanksgiving.
I apologize. I like rattling his cage.
You're pretty good at it.
We're friends, so friends do it in a loving fashion.
But I will need to know if you want to attend the entire conference. Or if you want to just go to the one day.
It starts
It starts the day before, but we can talk about that later.
I'm available. Shockingly.
Okay.
I'll
Back to
explain
the
after
regularly scheduled
after.
programming. Sorry about that.
No, that's great. That's great. That's great.
Ooh, look at the pretty graph.
Look at,
It's even higher now, but we'll look at that later. Every day, gross. So, okay, so we're in the painful last stretches. We're going to get there. And I know everyone gives, a lot of stars to the staff. The community members are. I would love to give 5 stars to the staff because I'm at the point now where I'm asking like, hey, I need you to just pull me this one random document or answer this one question. And there's never anyone like, everyone is like, how else can I help? How can I jump in? And this would not happen if it weren't all of the staff every day. So we're basically down to just the nitty gritty here. And I won't waste your time talking about, which plans we have and haven't done. Taylor kind of updated you. We're just waiting on the emergency operations plan, which the new employee, I basically told them in the interview, like, hey, this isn't for you. Just know you have a big project on the front end. And they have come right in and started working from day one. And we're going to get there by the skin of our teeth, if you will. So that's
Fortunately, he had worked at 2 other health
Yes.
departments doing that plan.
Yes.
So it was
Oh,
not his.
awesome.
right, yeah, which is great because we kind of have an expert. And his goal was for us to be the leading county in this. And I was like, that's the attitude.
I like that.
Yeah.
I was
Yes.
about to volunteer because I actually was involved at the Medical College, Georgia, in drafting around 9/11, the DMAT, the disaster paradigm, all
Yeah.
that. But if there's any need for an extra body from time to time to just listen and hear it, just let me know.
Okay, no, we will. That's great input. It's always, we like to have different looks from different views. That's always helpful. No, that's awesome. So that's,
No, I'm volunteering to assist,
yeah,
not supervise.
I'll write that down. Assist and not supervise. Okay. No, that is always helpful to have other voices and other perspectives.
If I can be of help, great.
No, thank you so much. So that's kind of the crux of this month is just the final stretches. We will be submitting by the 3rd. I like to submit everything at least the day or 2 before, just in case the computer crashes. So we're on target for there. Just a few more things to go. Another thing that I figured I mentioned with the new emergency response letter is we did actually get the remaining portion of the public health emergency preparedness grant that happened in November. So I didn't put it in the October board report, but we do have the full amount that we were expected to have budget for. So that should be coming in the coming days. Let's see, so finally we have the communicable disease report. And if there's any questions, you guys let me know. Oh, and then going forward, after we submit for accreditation, that starts the process where they will review our documents for several months. But the idea is that now that we've overturned all these rocks, we've had all these side projects. The good thing about accreditation is I've heard from mentors is like, kind of forces you to do all those projects. You're like, I wish we did this better. I wish we did that better. So we're gonna own our own. We have a very long laundry list of projects that once we hit the submit button, we're gonna start implementing those of like, wow, we really could be, you know, doing this more efficiently and more effectively. And so that's the laundry list that we're gonna start tackling on December the 4th going forward.
So remind me, once it's submitted, what's the timeline for knowing
Where we
something?
Okay, so I've heard, I think FAB, they've said really 6 to 8-ish months. I've heard anything from 4 months to get the turnaround, and I heard from another county, it was like 11 months. So I'm anticipating 6 to 8 months, but I'm planning like it's 4. And then once they bring back with any questions and documents need to reopen, you have 45 business days. That's where it's that stretch. So if there's some things, we have a good number of things that we've submitted, we've done the best we can, but I'm like, you know what, we're gonna keep working on that one in the background. So that if they have a question on that one, we are kind of already have. it, you
So
know.
Rebecca, I think you probably need to slow down and say what all this means.
Okay,
Like, what is going to happen?
okay. So we submit all of those documents that we have on the draft. They will review them. They will open up and say, you know what, we have a question on this process. We have a question on this program. And they will come back to us with said questions. And then once they bring us all of their questions, we have 45 business days to respond to the questions, clarify anything, improve any processes. And then after that, they look to come to do a site visit where they come here and we review things, review plans, and we talk to them about how we continuously improved our processes from there. Does that begin to answer that? I recognize I work in this every day and I
Sure.
jump in. So that's what we're looking for. And then after that, we go from there to see when we actually get the seal. And that kind of depends on how well we've done with the documents, how the site visit goes, and a couple of factors.
And so all that's great.
Yeah.
Getting accredited will be fine. What I really care about is the list of 200 things that we've discovered as we've gone through this process. Because there's probably a list of 200 at least processes that we could do better. And whether it be how we do ID cards for food handlers, whether it be, I mean, there's just all kinds of things that we said, put this on the back burner. We need to come back to do this in a better way. But there's some cool stuff that we can do better. And that's what we're going to go through once we hit that submit button. And then we're going to go through and prioritize even before I mean, there are some things probably on the immediate FAB accreditation thing that we know they're going to tell us we need a fix. So we probably have to prioritize just because we know FAB's going to tell us we have to do it. Sure. So we probably need to do those, but we know there's some things for us we want to do. And that's that whole continuing quality improvement project stuff for us that's going to make us, as Dr. Chaffee would say, the #1 health department in the state. Those are the things that are really going to make a difference, have nothing to do with that seal, but just has to do with better customer service, I mean, those are the exciting things that we've turned over. Rebecca hasn't had a chance to really be like, I'm so excited about those, but she will. These Bill's staying awake about these colors.
Yes, but no, that's what, yeah, that craft is my life. The other health departments told me, regardless of the seal, they like the systematic approach to actually working through projects. So I've had several of them say like, I don't want to work for health department, stop going towards this, because it does help you like systematically look at all these different processes.
So if we are to become one of the best health departments, if not the best health department in the state,
There we go.
one of the things I think that is above the bar, and I'm gonna throw this out just to put in the back of your minds as we go through this. There is a goal for us to perhaps take the lead on finding efficient ways for health departments that don't have the resources we have to be able to go through this process. To that end, if at some point we have a brief ad hoc committee meeting to go over what do we think the full-time equivalents were, what do we think the cost to us was from a financial and an HR standpoint, what were the efficient things that occurred as we went through this, what were inefficient, because I think we have an opportunity to take the lead for all the other health departments in the state to work with the Department of Health and Human Services to figure out a way that we might try to get every county in the state accredited. We are in a position as the best health department to maybe take that lead to figure out FAB is a business, it's an entity, it's trying to do things right, but reaching out and finding every one of the hurdles that are difficult to overcome for the health departments that don't have the resources we have. If you think of stuff, back page, jot some notes and things like that, because I think the best health department in the state would be this proactive to look forward to how can we help give feedback at a state level to how to bring every health department on board to have this level of a CQI system. If it's, and also we might be able to give FAB feedback as to how to make this more cost effective or provide resources, or we go to the state to say, if you can mobilize these resources, here's what we determined we need to do. This is what it cost us from an hourly FTE, or I am suggesting you look at that. If you have information, great. But keep in mind that as we finish this process, I think we have the potential to share and improve not just our county, but to take our lessons learned and work with the state and FAB and figure out ways that this kind of process is and can be facilitated in counties that don't have the resources.
Well,
We are.
I think you're going to love us, but even more than you already do.
Talk to my wife. I don't love anything more than her, but you're getting close.
Well, this whole process the whole way we have done it from the beginning has been with that concept in mind, because at least the three of us, and it kind of started with Taylor and I, has been to approach it from doing it in a health literate way. And everybody else that we have experienced, everyone else that we have looked at, it's been from a pretty complicated, very academic approach. And every document that we have written, everything we have done from the strategic plan, from all these plan documents, all of our documents that you looked at, I mean, we've shared some of them with you. They have all been simple. They have all been, so you know what, with 115 health departments across the state, you know there's a wide variance of ability. We have made it so the lowest common denominator, that smallest health department, they can read our documents. The highest level of health department, it's still relevant to them. So we intentionally made our documents, they're useful for everyone, but they're understandable to everyone too. And so that is not how everyone has done them. We looked at other people's documents. They're like 5 times as long and they're so terrible to read. And our documents, I can like I'm a 4th grader, so, or I act like a 4th grader. I don't know what she says.
Well, and
But-
this is something we can tackle outside of the meeting, but it seems to me that, and I'll close on this. This should not be a difficult process. And FAB, if I was there and part of their leadership, would say, why aren't we taking the most efficient documents and sharing them proactively? That we're going to provide you guys templates, change the name at the top, read through it, make sure you agree with it, because why don't we do that?
We have a lot of feedback for Fab, yeah.
Okay.
That's on the list, so,
Well, but that's, you see where I'm going, because I think we have a duty
yeah.
to take our experiences.
How many
We've
times
asked
have we
them
said
for
that?
examples, they won't give you examples, they'll be like, it is a privacy thing, so. and I'm like,
Well, then we'll do it in Missouri first.
Missouri is tackling that problem already. I brought it to this report, but Missouri Center of Public Health Excellence has always contacted me. And then how can we make this easier? And I was like, examples. So we're actually
Thank
looking
you.
at every single example. Like another health
That's-
department, like, I don't know what to do. I'm like, well, here's 3 counties that got these accepted.
So
We're
we
actually
had,
looking at consolidating and compiling.
You guys see where I'm going with
we had a temp employee do nothing except call the FAB accredited people and get samples from them. So we could compile the sample policies. So everyone has to do that now we're sharing those with MoCP, but it's ridiculous. Why didn't someone just do that so we could
Yes, right.
share them? Why are we having to do that?
And other
But
counties
yes.
directly as well. So,
You're right, we can discuss this.
Yeah. Well-
Someone has to take the lead and do
It's a
this stuff.
CQI process that has so much potential upside benefit. It shouldn't be a hurdle. It shouldn't be difficult. It should be handed and say, execute,
Mhm.
read, agree, submit, say, yes, we're doing this, and then execute, because that has a huge impact on the delivery of public health. So, all right, I get off my soapbox. I just wanted, you guys are already on it. Again, I'm behind the 8 ball on this. I'm playing catch up, but I'm thinking that
Yeah,
you guys are doing, we have such wonderful staff, resources, leadership. Why should it be this difficult to reinvent the wheel? It's round, it's got a hole in it and it rolls.
Well, I'm just not sure why some of these others are afraid to raise everybody up. Like,
Mhm.
So, okay, we're gonna be the best health department in the state. Let's go for the country. But part of that is taking the lessons learned, finding what ways, what's effective, sharing it, making it easy for the micro counties.
I send stuff to Randolph County weekly.
Great.
As soon as we get something, I'm like, here's what we think it is. So, but it'll be easier once we have our feedback so that I know I'm doing something good.
But this, in the same token, what if we do this at a statewide level, then I think the next step would be to consider getting with FAB and saying, guys, your whole purpose, your mission statement
Yeah.
is embodied, and why aren't you doing this? That would help not just the state of Missouri, but other people. Again, I'm getting out over my skis.
yeah,
on
the
this.
second smallest accredited health department in the country is in Missouri. And she will share anything with us. She is the most her name's Michelle Walker. She will share, she'll call us, she's the most helpful person ever. And some of the bigger health departments, it's like pulling teeth to get them to help. So it's just an interesting dynamic.
Thank you. Let's move on. Financial report or subcommittee chairs finance, sorry.
We met on the 12th of November and had lots of discussions. One of the things was the review of the purchasing policy, and we've kind of figured out that there is more to do on that. kind of some dirty work that Andrew's going to do before he presents it back to the committee. So we'll present that to you at a later time. And then we just talked about the fiscal budget for 2026 and the process of the financial department meeting with supervisors and managers individually and getting their input. So lots of communication going on within the departments with the financial planning for next year. That was about it. Andrew?
I don't have anything extra until we get to the new business.
Financial
Okay.
report.
Oh, I just gave it.
Okay. Review.
Sorry, I missed
review and
something.
approve the
I thought you
bills.
called for me.
Well, no, hey, you're fine. You're fine. It said
Okay.
subcommittee chairs finance and the next item was financial report. Sounds good. I was just going through the agenda. Sorry. I'm not thinking, I'm just doing. Bills.
I move that we pay the bills.
Seconded.
Any discussion?
No.
Hearing none, I'll take a motion.
A vote?
A vote.
A motion to approve the bills, paying of the bills. Oh, you just did first
You
and
did
second.
that.
No worries.
Just wake me up when this is over. Okay, then I'll do a roll call vote. Susan,
Yes.
Zach,
Yes.
Kim,
Yes.
Michael, yes. First draft of the budget, new business.
Fee resolution.
There is that one.
Okay. Susan, did you get my email?
Yes, I did.
So you should have on your desk proposed budget. It is a very rough and unbalanced budget at this point. What you'll notice is we are about $500,000 off right now. We are waiting for some things. The government shutdown delayed some of our income estimates. So when we give you a budget next month, it will not be $500,000 off because you will have a balanced budget one way or another. I blame Taylor. Because that's what I do.
That's your purview.
All
What
right.
happens when your deputy?
So one thing I do want to point out is last year, you may remember we had encumbered some funds and to the tune of, I think, $275,000. This year, we actually haven't touched those encumbered funds yet from that previous amount, so that's good. But we will before the month's over, before we get through December. But anyway, we do have a potential for some significant grant funds. We just don't know what they're going to be. It probably won't be the $412,000 that we requested, but hopefully it'll be, you know, $100,000 or even 50 to 75. I have no idea. But we will be better prepared next month to know what that is. Taylor, anything you want to talk about?
Related to the budget.
Mhm.
Yeah, we're just still going through it.
I will say one of the cool things about the budget this year is, as you all know, Dan is retired. And Dan did a lot of the preparation for the budget in previous years. And as you may have noticed, we have a lot of new supervisors. That's always been real important to me to put some of our younger folks in new supervisory positions. So for a lot of them, this is their first year of really trying to learn the budget. I really want to give a lot of kudos to Michelle and to our new supervisors and managers. because they have been working together, going through and learning the different accounts and the different things about. And over the next month, they're going to learn about cutting money and learning about having to pick priorities, which is going to be a good lesson.
Yeah.
And how, and learning to prioritize. I mean, I think everyone needs to learn that and they'll get better at it. But we also know we can, during the course of a year, move stuff between accounts and it's all necessary. But very proud of the team. Some of them are really having quite a bit of fun learning about this. I don't think when you are a program person, you always understand that this is real dollars and cents. Like sometimes you just are like, oh, can I buy this? And you don't understand that there's actually money out there budgeted. It's not just someone out there with a big wallet. Someone's actually, these are taxpayer funds. These are real dollars and cents that we have to allocate. And there's a limit. It's not just some big pot of money that we can just wantonly spend. So it's been good. I'm very proud of finance, Cindy and her team doing a good job, but Michelle and all the supervisors and managers, I think it's been a great experience. And Taylor just making it rain, that's kind of cool too, so.
See if we hear back from that contract.
Taylor's going to talk about a grant here in a minute, but she's learning that $10 million cybersecurity insurance coverage is ridiculous. So she's going to get to learn to negotiate with funders and tell them they're crazy. So we'll see how that goes.
If I may, the best line you might employ is that insurance is for risk mitigation. If we don't have the risk, we don't need to mitigate it. And 10 million, how on God's green earth can we take a loss of 10 million? And why should we pay for that? So
Right.
for what it's worth.
Well, and I think the way it's actually worded is just there. If we don't reach those circumstances, then I don't know, like we can't sue them.
We'll talk about.
Okay, we'll talk about
Right. All right, so
okay, so this is a new grant. It's a new so it's
Do we-
essentially.
sorry. The COLA is the next item on the agenda, if that's okay?
Yep.
Let's talk about that.
Yes. We don't have anything.
Okay,
At this point, because it'll be part of the budget.
yeah, okay.
But one of the things that I just want to give you a heads up, the Social Security COLA, I believe, is like 2.81%, I believe. So what we'll be proposing in the budget is 3%, just so you're not surprised.
And just for clarification for everybody who doesn't have a good handle on the difference between the COLA and the CPI. The COLA is derived from the Consumer Price Index, which is essentially a basket of goods that they look at from year to year and then calculate cost of living adjustment to set Social Security, and so many other people dovetail off of that for what it's worth.
Right, and how we will use that COLA is basically, we will just move all of our pay scales up to 3%. Is how we will adjust our pay scale.
Children's Trust Fund Contracted Services Agreement.
All right, so this is to do home visits for high-risk perinatal Medicaid for women who are pregnant through 1 year postpartum. So essentially, it's some of the work that our family support worker is already doing, but now the state is offering to give us a reimbursement of $200 per month, and they'll be giving those funds through the Children's Trust Fund. She usually has a caseload of about 20 people per month, and usually does usually one visit a month, but it might depend. So this is a new program, so we're not sure if immediately we'll get referrals from them. But we could get as many, I think up to 25 per month or at one time. So essentially, they're just giving us money now to do things we've already been doing.
And $200 per visit more than covers our cost to employ these services. That's a fair question,
Yeah, no, that's a good question.
because if it's $50 an hour employee who's got to travel an hour out, an hour back, that's 3 hours. It's $150 right there. I just want to make sure that we believe that the staff determined that that is adequate per visit, and that we will not lose money on it. But if we do, it's an acceptable loss that we decide to take. But at the same time, as we have opportunities to sign grants, of course, we want the money as long as it won't be a cost center to us unless we deem it valuable.
Right.
Okay.
I mean, right now we're getting 0, so it's $200.
And are we
Right.
doing this already?
They're
Yeah.
doing this already, yes.
Well, then,
Yeah.
I make them.
Your caseload
I
may
get what you're saying.
increase, is that what you're saying? You may get new referrals as a result?
So they rotate in and rotate out. So she's has a lower caseload right now because they're about to start this December 1st.
Okay.
So
So no
just to-
change to the amount?
I just need to.
no. I mean, and if we're like overloaded, we can always like tell them and they would send it somewhere else.
Okay,
In the interest of time, I'll make the motion to move to authorize the director to sign the Children's Trust Fund Contractual Services Agreement between PCHD and CTF for the period of December 1st, 2025 to November 30th, 2026. Do I hear a second?
Seconded.
Can we have a little bit of discussion before you vote?
Sure.
There is a contractual thing that before I sign, we do need to resolve regarding the insurance requirements, but I will take care of it before I sign it.
Okay.
And it's just, it's regarding the liability insurance regarding cybersecurity. They really do want us to have $10 million, and we will not agree to that.
What is the cost of the $10 million cybersecurity?
I can't even get it
Okay.
without some crazy, like, our insurer doesn't even offer that.
Who is requiring that?
The Children's Trust Fund or whatever. So we will talk to them. They'll either have to waive that or I won't be able to sign it.
so this grant is offered to other
Who's providing the grant?
children's trust funds. So
Children's Trust Fund.
And but who handles that? Is it a state? Is
So
it
it's a
an independent
state,
entity?
yeah.
Is taxpayer
So
funds?
it's taxpayers, it's all throughout the state of Missouri.
Right.
So this is different than the children's fund and the.
I would like to be made aware if they're inflexible
Yeah.
in this, because this is
Agreed.
political ramifications that I believe a trustee would be best served to communicate with our legislators that this is a unachievable requirement.
yeah,
We'll negotiate.
Should
with them.
we say that in the board motion? Does that need to be stated?
Well, I think we're just authorizing.
We're authorizing
him to do it if it seems reasonable. We're not really directing him to make the agreement.
He can sign it, they can
Authority
decline it.
to.
I think we should go for it,
Okay,
but he's got to
okay, I see.
convince them that they need to agree to our signature.
Yeah,
Yes, okay.
yeah, I mean, if you want to amend the motion, that's fine. I'm just not going to.
I just
sign
leave it where it is.
Yeah.
It's
good
fine,
information.
it's fine.
We may not get it because, but
Yeah.
who's gonna, if we can't get the insurance requirements, who's gonna get it? And my fear is
Yeah, that's true. That's
there's
crazy.
that this is money that's gonna get left and sit without enough
Mhm.
informative political leveraging to show that this money's not going to get deployed to help people because of their administrative requirement.
I'll let you know next month, but my guess is this was some boilerplate thing that the attorney drew up that they pulled from some other contract, that they left that amount in, that it was unintentional.
Sure.
is my guess.
Andrew to
Very well
fix.
They will probably come back and say, oh, we can do this for what, that's a huge amount. When we talk to our underwriters, they're like, yeah, no one does that amount.
Okay.
That's crazy.
Okay,
So we just need to vote.
Susan, vote.
Yes.
Zach,
Yes.
Kim,
Yes.
Michael, yes. All right, personnel actions.
Your language is on the board packet. Oh. Is it on the?
All right, we'll need to scroll down so we can do the personnel actions. My
Here
bad.
it is.
Oh, okay. It's- Sorry, I tried to fix the problem before I got here.
It's okay.
Following personnel action for the Platte County Health Department, Andrew Carpenter has been hired as a full-time emergency response planner 2, effective November 3rd, 2025. Andrew will be at scale step 1410A. Salary started at $31.39 per hour. Requires director's evaluation approval.
And then the director's evaluation approval is what you all approved last month. But we did not vote on it
Okay.
after, and we should have voted on it when we went back into open session, but I told you wrong.
No problem.
Okay.
So I guess we need to go ahead and approve the personal action as just stated, or do I need to restate? I think we're fine to state that the personal action as in the board packet, we are going to, I'd like to make a motion to approve the personnel actions in the board packet.
I second that.
Roll call vote, Susan,
Yes.
Zach,
Yes.
Kim,
Yes.
Michael, yes. All right. No public comments. Next meeting, December 18th. Do we have any executive session items? Hearing none, I would entertain a motion to adjourn.
I move to adjourn.
A second.
Susan,
Yes.
Zach,
Yes.
Kim,
Yes.
Michael, yes. Like the ball.